Welcome to Unit 1, Introduction to Co-Occurring Disorders, a part of the Quickstart Guide for Recovery from Addiction and Co-Occurring Disorders by Dr. Dawn-Elise Snipes. In Unit 1, you're going to learn about the co-occurring disorders, how to enhance motivation and momentum. You're going to learn to set goals and develop confidence in your ability for change. You'll start out by defining addiction and mood and other co-occurring disorders, which may be present in early recovery. You're going to explore how these issues interact. For example, how does depression trigger addiction, and how does addiction cause depression? How does pain cause depression, which can cause addiction? We're going to look at how all those things interact and explore why it's important to approach recovery from a holistic point of view. You're going to learn about how to enhance different types of motivation to develop momentum, the stages of readiness for change, and how to move from one stage to the next, because we'll start out potentially, hopefully, in the action phase of change. But when things get tough or when other priorities seem to creep up, our motivation for change may go from action back to contemplation. And it's important to recognize when our motivation is waning and have the skills to enhance our motivation in order to keep moving forward in the process. Finally, you'll learn how to set and achieve SMART goals and how to bolster your self-efficacy or self-confidence. Many addictions, mental health issues, and physical health problems may be present in early recovery. I mean, after all, during your addiction, you probably weren't taking 100% of the best care of yourself. All of these issues interact, which is why it's vital to use a holistic approach to treatment. Let's start out by looking at addiction. The continued use of a substance, person, or activity to eliminate or escape from discomfort despite experiencing negative consequences from use. And that's really the kicker there. A lot of people use substances, people, or activities to temporarily escape from discomfort occasionally. It's when you continue to use it despite experiencing negative consequences from use that it really becomes a problem. Some of the criteria we use when we're trying to identify if a person meets the criteria for problematic use or addiction is whether they've tried unsuccessfully to quit, if they've spent more time or money than intended thinking about getting, using, or recovering from the substance or behavior, reduced involvement in important personal activities, or experiencing repeated health, mental health, relationship, financial, employment, or legal problems as the result of use. Now, before we go any further, I want you to remember that addictions are a creative solution to a problem. You didn't want to die. You also didn't want to feel that pain anymore or feel that distress anymore. So you continued to use until you could find alternate skills. And now you're trying to develop those alternate skills. Instead of viewing your past behaviors as something that is going to impact your self-esteem negatively, view it as the best that you could do with the tools you had at that point in time. And you're developing new tools now. Start out by thinking about something simple like alcohol. A lot of people have had difficulty with alcohol, and they have tried unsuccessfully to quit. They've spent more time or money than intended. Maybe they spend a little longer at the bar than they intended, have a few more drinks than they intended. They may spend more time using than intended. They may also spend more time recovering from use than intended. And this can be recovering that is sobering up, or recovering in terms of repairing relationships that are damaged as a result of use, or trying to catch up at work because you spent too long drinking at lunch and you didn't come back and then you got in trouble at work. So there's a lot of different ways you can recover from use, but it takes an inordinate amount of time. This often leads to reduced involvement in personal activities that are important to you, like going to your kid's soccer game or working out or just spending time with your family or your hobbies, whatever it is. And you forego those things in order to use. So in this case, in order to drink alcohol, or you may not have the energy, or you may be too hungover in order to engage in those things. So you don't go do them. You also may experience repeated health or mental health problems as the result of use. A lot of people, when they use, don't take great care of themselves. So if they've got autoimmune disorders or diabetes or hypertension, those things may get worse. Your general physical health may get worse because of all the stress your body is under. Your mental health may suffer because you start feeling depressed or anxious or frustrated, having more difficulty with anger management. All of these can contribute to problems in your relationships with other people. You can experience financial difficulty because you are spending too much money on alcohol, or you lose your job. And you can also experience problems at work or in the legal system as the result of drinking. So thinking about your drinking patterns, if you've experienced these symptoms, if this sounds like you because of alcohol, then you very well may have an alcohol addiction. But substances are not the only thing that you can be addicted to. Think about relationships. Have you ever been in a relationship that you tried unsuccessfully to get out of? You may get out of it for a little while, and then you go back and you keep doing that thing. You say, no, I'm done. This is it. But then you go back. All right. So same sort of thing with relationships as we saw with alcohol. Spending more time or money than intended thinking about that person, trying to spend time with that person, and recovering from the mental health or physical health or financial effects of spending time with that person. Reduced involvement in important personal activities. Maybe you quit going to the gym or quit hanging out with your best friends because you're spending time with this person. And you notice that it's causing problems in your other relationships, but you don't care. And experiencing repeated mental health problems as a result, or relationship issues with your other relationships as the result of this particular relationship that you just can't quit. Financial problems as the result of being in this relationship. And maybe even difficulty at your work because you're spending time with this person, so you're not focusing on what you're supposed to be doing. You may be texting at work, or that person shows up at your job and causes problems. There are a lot of different ways that problematic relationships can cause problems for you financially at your work or even legally. If you look back over relationship, especially one that you're in right now, and this sounds like that relationship, it just kind of drug you down, it's important to recognize that while it may have felt better than what you thought it would feel like to be alone, there are a lot of negative aspects to it. So spend some time thinking about the different things that you might be addicted to, including gambling, gaming, sex, pornography, and even food, in addition to alcohol, drugs, and relationships. Identify all of these things because you have, or probably have, one or two addictions of choice. But when you can't access those, it's likely that you will go to other addictive behaviors in order to numb the pain, in order to help you feel better in the short term at least. These are potential relapse warning signs, and it's important to know what your relapse warning signs are. So if you can't access that primary addiction, what do you turn to instead that is also problematic, that you do instead of actually coping with whatever's causing the problem and eliminating that situation? It's also important to remember that you are a person with an addiction. When you no longer have symptoms of the addiction, you are still going to be a person. And that's crucial because when that addiction symptoms are gone, what kind of a person do you want to be? Spend some time thinking about that and write it down in your journal, noting what you hope to be like in recovery. Think about what you were like before you started using or before you got involved with that person. and, the things that you liked about you beforehand. If you can't remember, no worries. Just think about what you're going to be when you find recovery. But you want to recognize that you are a person and you have always been a person. And my belief is you've been a good person. You have just made some choices along the way that have gotten in your way of being the person that you want to be. Mood disorders are basically depression, anxiety, and bipolar disorder. And we're going to talk about depression and mania for the rest of this video. Most people, when they are in early recovery, experience mood disorders. Mood disorders can cause or worsen mental health issues and may trigger addictive behaviors. A lot of people, when they feel depressed or they feel anxious, they may use in order to self-medicate. When they are in a manic or hypomanic episode, they may use just to intensify the euphoria. Addictive behaviors alter brain chemicals, which will trigger depression or anxiety or other mental health issues. We tend to see that if somebody uses depressants, for example, that slows them down, it calms them down. So when they start to sober up, they experience a lot more anxiety. People who use stimulants like cocaine tend to be excitable and have a lot of anxiety or may have anxiety when they're using, but as they sober up, they experience a lot more depression. That's because the brain is trying to rebalance its chemical symptoms. We want to chemical systems, and that causes those symptoms that people feel. We want to recognize that. I want you to recognize that in early recovery, you're probably going to have periods where you feel depressed or anxious or both. And it's going to be important to identify ways to deal with that other than self-medicating. Mood disorders also alter your brain chemistry, so you may try to self-medicate with addictive behaviors. When you are feeling depressed or anxious, you may try to make yourself feel better by using addictive behaviors, which trigger a whole bunch of other chemicals in your brain that do make you feel good, no doubt. It's important that you make sure to treat all of your physiological, psychological, and addictive issues at the same time. Because if you are anxious or in pain or depressed, it's going to be really hard to stay sober. Spend some time thinking back over your history. In what ways has depression, guilt, anxiety, anger, or resentment triggered your addictive behaviors in the past? In what ways has your addiction caused depression, anxiety, guilt, anger, resentment? And how have health problems or pain triggered feelings of depression, anxiety, anger, resentment, or guilt? Sometimes when we have a lot of pain, we may not have the energy, or we may not feel like we can move and do the things that we feel like we should be doing, like walking the dog or cleaning the house, and we may feel guilty for that. And that guilt can further trigger an addiction relapse or trigger self-medicating with substances. So it's important to recognize that pain can trigger unpleasant moods, which can trigger addiction, and then pain itself can also trigger addictive behaviors if you are addicted to opioids or other painkillers. Depression, as I said earlier, is likely going to affect you in early recovery at least sometime. Even if you used depressants when you were actively using, there's going to be a period in early recovery, potentially, when you are assessing the damage that occurred in during the time you were using, and you may experience a fair amount of depression and guilt and grief. And it's important to recognize that those are normal emotions. It's also important to recognize the symptoms of depression, how they can trigger a relapse, and what you're going to do about them. So for each of the symptoms on this slide, I want you to think about how each symptom could trigger addictive behavior and what are 3 ways you could deal with it. So how could apathy and low mood trigger addictive behavior. Most people don't want to feel like Eeyore day in and day out. They don't want to feel like there's no color to life, like it's just all gray, all blah. So it is tempting to engage in some sort of behavior that may produce a feeling of some sort of a rush, which is potentially the road to a relapse, if not a relapse in and of itself. What could you do? What things can you do to help yourself cope when you are feeling blah, apathetic, you have low mood, maybe not super depressed, but you have that nothing gives you pleasure sort of thing going on? What are things that you can do to cope with changes in eating and sleeping patterns? You're going to learn in other units about how important nutrition and sleep are to help your body recover and rebalance your brain chemicals so you can feel as happy as you can feel. You need to allow your body to recover. And when those things are out of whack, it's more difficult for you to feel happy. It's more difficult for you to have energy. How can you deal with appetite problems and poor sleep in order to prevent a relapse? How can you deal with excessive guilt, difficulty concentrating, fatigue, the feeling that you've got, 100-pound rucksack on your back and every step you take is just a ton of work. And that's what is psychomotor slowing. It means, you feel like everything you do, you're just kind of doing in slow motion. It's not so much being sleepy, tired. It's feeling heavy and weighed down. And finally, thoughts of suicide. And this is really important to identify what you are going to do if you start having suicidal thoughts. That is not something to play with. If you start having thoughts of suicide, how can you keep yourself safe? Who can you call? If they are imminent thoughts of suicide, then you need to call 911 and get to a safe place. That is extremely important. If you're starting to feel suicidal, you don't want to try to deal with it all by yourself. You need assistance. You need support. And like I told you, we were going to talk about mania. Now, not everybody is going to experience a manic or a hypomanic episode in recovery. However, if you do, it's important to recognize how each symptom could trigger addictive behavior and 3 ways that you could deal with each symptom that would make sense for you. So the symptoms that you're going to go through one by one include elevated, expansive, or irritable mood. So if you have an elevated or expansive mood, you are just high on life. Irritable mood, on the other hand, you're touchy, you have a really short fuse. Inflated self-esteem or grandiosity. If you feel like you are all that, the term narcissist goes around a lot right now on social media. So think about narcissism. Somebody who's manic, you can't tell them anything. They think they know everything about everything. If you have a decreased need for sleep, and this isn't insomnia, it's not that you want to sleep but you can't sleep. When you are in a manic or hypomanic episode, you have a decreased need. You just don't feel sleepy. If you are more talkative than usual, now this may not be a huge relapse problem, but it may be a sign that a manic episode is impending. And people who are in a manic episode tend to just talk and talk and talk. And you're like, okay, are you going to take a breath? You may have racing thoughts. That can be a relapse trigger because racing thoughts tend to go from pleasurable activity to, oh, this person made me mad, to pleasurable activity. And you're not thinking before you act. You just have all these thoughts going on. And, it's kind of like being in a laser tag studio or something. And distractibility is another thing that's common in hypomania and mania that you need to be aware of. Someone who is in a manic episode is probably going to have more difficulty focusing. They'll have more difficulty focusing reading the big book, more difficulty focusing on doing the next right thing because they are so easily distracted by something that seems a lot more fun. Think about the dog in the movie Up. He was just going along. He'd be talking and then he'd be like, squirrel. That's kind of what being in a hypomanic episode might be like. Having that distractibility where you see something that catches your attention and it's hard to focus on what you need to be doing. Increases in goal-directed activity or restlessness are also common. So if you get obsessed about something and you've got to learn everything about it, that could be a good thing. But if it starts causing problems in the rest of your life, then we've crossed over to where it's a problem. And finally, people who are in a manic or hypomanic episode are often impulsive with excessive involvement in pleasurable activities, including sex. And they're looking for something that has a high potential, high reward possibility. But generally, that also means a high risk probability. One of the early symptoms of an impending hypomanic or manic episode for a lot of people is hypersexuality. They start feeling this sex drive that is just going crazy. That's not true for everybody, but it is something to be aware of if that's one of your symptoms. Again, go through each symptom, think about how each symptom might trigger a relapse, and identify 3 ways that you could cope if you start having that symptom.